So following on from the talks on Kangaroo Island, I was actually one of the vets that worked there in 0506 on the sterilisation program. So, what's that noise? Little did I know at the time that I would then go on to do a PhD on koala health starting in 2008. So I'll use this. So that PhD topic was looking at the kidney disease that affects Mount Lofty koalas, which is called Oxide Nephrosis, and I'll talk a bit more about that in a moment. But what I really wanted to talk about is, since I've become a lecturer at the School of Animal and Veterinary Sciences, that we've been able to form a great koala research group that focuses on looking at health and disease issues in South Australia. And this has been able to happen really well because of bringing together a lot of veterinary specialists. So this includes Wayne Boardman, who's over there, who's a specialist in wildlife health, also a wildlife pathologist, Dr. Lucy Wolford, microbiologist, Professor Darren Trott, virologist, Dr. Farid Hemmetsadar. And together we've been able to supervise quite a lot of student projects on koala health. So we've had about 5 honours students work under us. We have these clinical research projects that occur in the 4th year of their veterinary degree. We've supervised about 10 of those, and there's currently 1 PhD candidate working with us. And we've also been collaborating with interstate researchers in Queensland and Victoria particularly on some of the disease problems that are getting seen nationally. But in terms of the South Australian population, not much was known about the diseases that are affecting koalas in South Australia. So just as an overview, we looked at 85 koalas at post-mortem. So these were animals that had been euthanised on welfare grounds due to injury or disease, or that they had died naturally. So we were receiving those bodies to examine. So we found that more than half of these koalas showed traumatic injury. Most of these were due to motor vehicle accident. But there were some that were also due to canine attacks, whether that be domestic or wild dogs. So this is similar to what's been found in other states, where because of the proximity of koala populations to suburb or urban development, that there is going to be that interaction there where cars are unfortunately either injuring or killing koalas. The next most common condition that affected koalas in the Mount Lofty population was the disease that I covered for my PhD, which is oxide nephrosis. So again, I'll talk about this a bit more in a moment, but it is a kidney disease that's affecting a high number of Mount Lofty koalas. Another interesting disease that was shown in this study was that Cycloptic Mange has been described now for the first time in wild koala populations. So it was actually like an outbreak situation that occurred in South Australia, but also in Victoria. So we're collaborating with some of the wildlife health personnel, like Dr. Pam Whiteley at University of Melbourne, to bring together a publication on the mange outbreak, and also chlamydiosis, which I will talk about a bit more now. So chlamydia testing has been undertaken in South Australia, but not for some time. So we were really interested in getting a current indication of the prevalence of chlamydia in the Mount Lofty and Kangaroo Island populations. So this, of course, is a disease that affects Queensland and New South Wales koalas with high prevalence and also high severity, so causing conjunctivitis and blindness where it's affecting the eyes, or infertility and urinary tract infection with the urogenital species of chlamydia. So recently a few cases of conjunctivitis were diagnosed in the Mount Lofty population, and then since then we've, again, by using necropsy investigation of koalas that we were receiving at the vet school, we found that there was 88% that were screening via PCR as being chlamydia positive, which is much higher than we expected. But the difference between this and what is seen in Queensland and New South Wales is that we have quite a mild disease here. So the reason that it's not getting noticed in the Mount Lofty population is that the signs of chlamydia are not always externally obvious to people that are dealing with those koalas. The most common diseases were the conjunctivitis and the urinary tract or wet bottom syndrome, rather than the reproductive disease as well, in that particular study that we undertook. And currently the PhD candidate, Jess Fabian, is looking at koala chlamydia in Mount Lofty and Kangaroo Island, but also how that is interacting with the Koala Retrovirus. So the Koala Retrovirus is endogenised in the Queensland and New South Wales koalas, which means that it's actually integrated itself into the into the genes of the koalas through those states, and it's at 100% prevalence. So that's why Koala Retrovirus has been quite a sort of hot topic in recent years, because it was only recently described. It's thought to be associated with cancers of the lymphocytes, so that means that it can cause lymph node or lymphoma type cancers or leukemia. And so it has been investigated on Kangaroo Island and determined to be at 15% prevalence by one of our collaborators from Queensland, Greg Simmons. But the difference there between the koalas on Kangaroo Island and the Queensland, New South Wales one is that the indication is that the Kangaroo Island koalas don't have that endogenised retrovirus, so it hasn't yet inserted itself into the genome of the koala, and that it's most likely been spread exogenously, which may be through scratching and biting during fighting, or even via an insect vector. So we're wanting to retest Kangaroo Island koalas, which has occurred, but we're still waiting for those results. This again is for the PhD that Jessica Fabian's undertaking, and also looking at the Koala Retrovirus in the Mount Lofty population, because they haven't been previously tested. And so what's been found in the Mount Lofty is that there is a higher prevalence than was initially thought as well. So Jessica actually found that there was approximately 2/3 of the population that had positive results for the retrovirus testing. So again, just to give an overview of the scope of the research that we have undertaken. So this topic on oxide nephrosis was part of my PhD. So this is a disease where these calcium oxalate crystals are deposited within the kidney tissue of the koalas, and this leads to dysfunctioning of the kidneys, so that the animal starts to go into renal failure, kidney failure. So they show signs of that we associate with kidney disease. So they're very thirsty, they produce dilute urine, that leads to them becoming dehydrated, and then they'll start to gradually feel unwell, so they'll have poor appetite and gradually lose weight, and will either pass away, or if they're seen by a veterinarian, and they're in that end stage kidney disease state, that they are a candidate for euthanasia. So as part of my PhD, I described the pathology of this disease, and that included the blood and urine abnormalities that are seen, including the high urinary oxalate levels. And so this has helped vets in South Australia to be able to diagnose this disease and understand more about how it affects koalas. So of the 51 koalas that I investigated, that was seen at 55% prevalence.